Welcome to our virtual family council. My name is Jamie Rose. I'm your virtual meeting coordinator. We'll review our confidentiality reminder at this point. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you connected to your assigned ombudsman. And a reminder, these calls have public access and are designed for family members and friends of residents in long-term care facilities. We'll review our meeting agenda. So we're going to get our virtual meeting tips from Jay, and then we're going to hear about community health choices. I'm really excited about this presentation. And then at the end of the meeting, I'll hop back on and review our upcoming meeting topics. Without further ado, I will turn it over to Mr. Jay Rotz for our virtual meeting tips. Oh, I can't hear you, Jay.
Jamie, do you want me to?
Thank you, Eliza.
So I'm hopping in for Jay since he's muted for some reason. You all have been placed in mute upon entry. We will open the lines in a bit so that you are able to share. If you'd like to speak or if you have a question, please use the raise hand feature. Once you raise your hand, we will know to acknowledge you and unmute your line. If you hover your mouse near the bottom of your screen, you will see the participants tab. You can expand it if you would like to see who all is in the chat tonight. The chat feature is at the bottom of your screen as well. Once you maximize it, you will be able to chat with presenters or others during the meeting. If you need to step away, you can stop sharing your camera by clicking on the camera icon at the bottom of the screen. You can click on that again to start sharing your camera when you return. Concerns or complaints can be directed to the State Ombudsman Office at 717-783-8975 or by email at ltc-ombudsman@pa.gov.
Thank you so much, Eliza.
Sorry.
Well, I appreciate you jumping in there. And I would like to introduce our main speaker this evening, Sara Rittenhauer. She is the manager of the long-term, I always forget this first S. Help me out, Sara.
Services and supports.
Services and support. There we go. Behavioral health and collaborative services, community health choices. So I'll be quiet and we'll listen to all the great services that Sara can share with us today. So welcome.
Thank you. Appreciate that. So you're able to hear me okay?
Yes.
Okay, great. So good evening, everyone. I'm pretty excited to present to you about community health choices and the different ways that we can maybe serve the folks that you love and that are in the facilities. So first, I'd like to introduce myself. As Jamie stated, my name is Sara Reitenauer. I am the manager of the LTSS Behavioral Health and Collaborative Services team for AmeriHealth, Caritas, and Keystone First Community Health Choices, and I'll go over that as we go through the presentation. By history, just to give you some background information on who I am and where I'm coming from. So I worked for the state of Pennsylvania for 25 years. I worked as an OVR counselor for 20 of those years, and then I also worked seeing statewide health programs for the Pennsylvania Department of Health. After leaving state employment, I worked as a project manager for a behavioral health managed care organization, a Medicaid managed care organization, and I've worked for the AmeriHealth since 2016. In that capacity, I worked again doing what we call integrated health initiatives for the Health Choices program, and then, as I said, currently I'm working as the manager for the LTSS Behavioral Health and Collaborative Services team under the Long-Term Services and Supports program. So basically what that means in a nutshell is I oversee our plan's efforts to coordinate services and connect people to employment services, nursing home transition services, and behavioral health services. So I have 3 distinct teams that under me that report to me that have those areas of focus. So for today, what I'd like to do is just provide an education to you, review Medicaid in general in Pennsylvania, but then especially highlight the newest Medicaid product, which is the Community Health Choices program. I'd like to give you a forum in order for you to answer questions and be a resource to you going forward if you do have any questions about Community Health Choices. So Jamie, if you want to go to the first graphic that I'd like to share. Thank you. So what you see here is you see a map of Pennsylvania, and Health Choices, or the managed care Medicaid program, is divided into 5 different what we call zones. So you'll see in that kind of reddish zone in the left, we call that the Southwest, and then you have the Northwest in the green, the Northeast in the yellow, down in that golden color, that's the Southeast, and then that kind of bluish grayish color, that's the area that we call the Lehigh Capital Zone. So what happens is with Medicaid in Pennsylvania, there are 3 different Medicaid products in Pennsylvania. The first is what we call Health Choices, and that is the one that I'm guessing you would most likely think of automatically when someone says Medicaid. That is your physical health insurance for people who are on Medicaid. It goes from the time it can go from a time a person is born all the way on up. And then there's another product called the Behavioral Health Managed Care Organization and Behavioral Health Choices. So Pennsylvania has what we call a carve-out model. You have those physical health insurances, and then you have behavioral health. It's a completely distinct and different product. And up until 2016, the 2 of them, the physical health and the behavioral health, really didn't even talk to each other. They didn't share information. They did not take a more holistic approach. In 2016, the state implemented some programs that required basically the 2 to play nicely in the sandbox and to communicate so that someone could get more of a holistic approach to care. But then the newest product of Medicaid came along, and in 2018, Community Health Choices was born, basically. So let me just tell you with the Health Choices, and I'll get into that, with the physical health choices, you can see each of these zones here. Each zone has some specific managed care organizations that are working in each of those zones. They're not identical. In one zone you may have company 1, 2, 3, and then in another you might have 1, 2, 5. But either way, there are Medicaid managed care organizations that are working in each zone, and the members, the people who are on Medicaid, can choose whichever one they want. They can switch between them at any point in time, but they can pretty much pick and choose which ones they want. With the Behavioral Health Managed Care Organization, it's a little different. So each county has one Behavioral Health Managed Care Organization. So the members who are residing in that county do not have a choice. They cannot switch between the managed care organizations. They have to use that one that is designated for that specific county. So for instance, Allegheny County has Community Care Behavioral Health. Montgomery County has Magellan Behavioral Health. Dauphin County has Perform Care. So, the people that are residing in those specific counties do not have a choice. Those are the managed care organizations for the behavioral health services. Then comes along Community Health Choices. So Community Health Choices, there are 3 Community Health Choices plans. Those plans are across the entire state. They are in every single county, and we call them participants. Those participants can choose which of those managed care organizations they want to be a part of. They want to have as their insurance company. The managed care organizations for community health choices are directly contracted with the state, where we're contracted with the Department of Human Services, with the Office of Long-Term Living. Community health choices is for individuals who are ages 21 and up. So unlike the behavioral health and the health choices plans, they are for, like I said, birth on up. Community health choices is for ages 21 on up. We have two primary populations that are covered by community health choices. The first is what we call community well duals. So that population includes anybody who is on Medicaid and who also has Medicare or a Medicare product, like a dual special needs plan. So if they have Medicare or a Medicare product and Medicaid, they are going to be part of the Community Health Choices program. And like I said, we call those, that population, the community well duals. The managed care organization's role in their lives is that we serve as their secondary payer. So we would help with co-pays, deductibles, things like that. We are their secondary insurance. The other population that we have are what we call LTSS, or long-term services and supports. This population is divided into two subcategories. The first is what we call home and community-based service individuals. So those are folks who have been through the independent enrollment broker process. They've been determined eligible to meet the medical criteria for long-term services and supports. They've gone through the process for financial eligibility with the Department of Welfare, and they are getting in-home community support. So if you think about things like, we call them personal assistance services, or, you know, back in the day, we used to call them attendant services. It could be home delivered meals, non-medical transportation, adult daycare, things like that. The other population under those long-term services and supports that Okay, are you able to hear me now? Someone muted me.
Yes. Sorry about that.
Oh, it's okay. It's okay. So I'm not sure where I left off, but so I told you about the home and community-based population under long-term services and supports. The other population is those individuals who are in a nursing facility. So if someone is in a nursing facility and their stay is being paid for by Medicaid, they will be part of the Community Health Choices program. Those individuals are under that umbrella category of long-term services and supports, but they are not in the community. They are that second subcategory of being in a nursing facility. I want to make sure I'm not missing out on anything. So Jamie, if you want to go to the next slide or the next graphic, please. Thank you. So Community Health Choices statewide has a population pretty much around the 454,000. 93% of them you'll see is what they call dual eligibles. So those are people that have both Medicare and Medicaid. Those individuals could be part of the Community Well Dual program. They could be where they are living in the community and they get those long-term services and supports, but they also have Medicare, or they could be in a nursing facility and have Medicare. But you can see that the largest population are those that have some kind of Medicare product. You can see here where it says, looking at the breakdown, where it says 15% duals in waivers. So those are Medicare and Medicaid folks who are receiving community waivers, who are part of that long-term services and supports in the community. You can see that 15% have Medicare and Medicaid and are in a nursing facility. 6% are non-duals, so those are straight Medicaid, but they qualify for those long-term services and supports in the community. You see that only 2% are people who are straight Medicaid and are living in a nursing facility. Okay, I just wanted to give you an idea of what our population breakdown is. So if you want to go to the next graphic, please. So for all participants, so whether they are in the nursing facility, whether they are in the community, whether they are part of that community well dual population, we help pay for their physical health services. So we're part of that physical health regular, what you would imagine type of insurance. It could be orthopedic doctors or primary care, lab work, things like that. So any of those, the whole population that we cover, we provide coverage for their physical health services. For people who have a dual special needs plan or people who have Medicare, again, we are their secondary payer, regardless of what category of CHC they're in. If someone is straight Medicaid, they do not have another insurance, then of course we are their primary insurer. And you'll see the note there that says that people's Medicare coverage does not change. People do not have to give up their Medicare. They don't have to give up the dual special needs plan. Nothing changes with that. It's just that we are their secondary payer. So if you'd like to go to the next graphic, please. For those individuals who are in the community, and some of these are also for people in the nursing facility, but these are primarily those home and community-based individuals. These are the different services that are part of that long-term services and supports package. So if someone is living in the community, they could get adult living, they could get assistive technology, behavioral therapy. There's employment services that they could get, such as benefits counseling, career assessment. They could get a myriad of services. This is, those supports that we provide in the community. The idea is to help an individual stay in the community, live in the least restrictive environment that they're able to, and to provide the supports so that they can age in place if they're able to. Okay. Okay, if you'd like to go ahead and move on. So I had mentioned before that there are 3 CHC managed care organizations. Now I know you can see that there are 4 listed here. So when I introduced myself, I told you that we are that I work for AmeriHealth Caritas and Keystone First Community Health Choices. So the company that I work for, and I apologize, my VPN went out, so I'm just going to log in really quickly. Sorry, my apologies. Technology is great when it works, right? Let me just do this, and then we can get back to it. Thank you for being patient with me. Okay. So I was telling you that that AmeriHealth Caritas, so AmeriHealth Caritas and Keystone First Community Health Choices is one plan. So I know that it's that we come under 2 names, but we are listed. We are actually one plan in the Southeast. Do you remember that map that I showed you, the golden colors? So down in Bucks, Chester, Delaware, Montgomery, and Philadelphia counties, we are known as Keystone First Community Health Choices. In the rest of the state, we are known as AmeriHealth Caritas. And then there are 2 other plans, UPMC and Pennsylvania Health and Wellness. I am like having some technical issues over here, so
I think you're muted.
I am not able to
Oh, you had it there for a second.
There, you can hear me?
Yes.
So my apologies, everyone. Oh my goodness. So like I was saying, AmeriHealth Caritas, we are known as AmeriHealth Caritas throughout the entire part of the state, except in the Southeast, where we are known as Keystone First. And then we have Pennsylvania Health and Wellness and UPMC Community Health Choices. These are the three Community Health Choices plans. And as I had mentioned before, people are able to actually switch between the plans. If they start with one and they, decide that they'd want to move to another plan, they are more than welcome to have that liberty. When Community Health Choices first started, we rolled out in the Southwest back in January of 2018. We then expanded to those Southeast counties in January of 2019. And then in January 2020, we went into the rest of the state. So we went into the Northwest, the Northeast, and then the Lehigh Capital Zone. If you remember that blue section of the map, we fondly call this the T zone. So if you'd want to go to the next graphic, please. This is basically just the map brought back. And so like I said, in 2018, we were over there in the red counties. In 2019, we were over in the gold counties. And then in January of 2020, we went into the other three zones. Of course, if you think about this, we moved into those three zones January 1st of 2020, and then we all know what happened in March of 2020. So it made for an interesting time. Now we are what we call fully implemented. It's called steady state. So, we've gotten everything rolled out, and we are just kind of moving along then. So if you'd want to move to the next graphic, this talks about what are the goals of Community Health Choices. So why did Community Health Choices even come about? So the goals were that to enhance opportunities for community-based living. We hear a lot about where we want to, if it's possible, help participants, individuals move from a nursing facility into the community. We engage in nursing home transition services, so we want to enhance the opportunities for that community-based living. We want to strengthen coordination with our program and other healthcare, including Medicare and Medicaid. It's one of the first opportunities that we have where we are really trying to approach the person in a holistic type of viewpoint, where we're trying to take into consideration everything and also work with their primary insurance to see if we can coordinate that care. We want to enhance quality and accountability, advance program innovation, and increase efficiencies and effectiveness. So what does this mean basically for individuals who are in a nursing facility? So every person that's covered by Medicaid in a facility, whether they have Medicare or not, is covered by a CHC managed care organization. What we do with this is we try to help with managing their care, making sure that they are getting the kind of care that they need. We want to help with care coordination. So again, trying to match those Medicare services, making sure that we fill in any gaps. We also strive to coordinate behavioral health services. Behavioral health services for people who are in a nursing facility are very scant. And so it's one of our efforts where we are trying to coordinate those services to ensure that individuals who are in a nursing facility and are covered by the Community Health Choices program has the support that they need to access those services. And then we also strive to help with nursing home transition. So I showed you those services and benefits that are available to participants in the community. We have individuals every day who are transitioning out of the nursing facility, are returning back to the community, and are receiving those kinds of supports in order to maximize their ability of success in the community. So every person that is in a nursing facility has a service coordinator. This is something that is new. For Community Health Choices and new for individuals who are covered by Medicaid in a nursing facility. So we have some accountability, we have some support to families and to individuals who are living in the nursing facility to coordinate that care, and then also to provide supports that would be needed if transition out of the nursing facility is an option. For individuals, like I said, who are in need of behavioral health services, they can contact their service coordinator, and their service coordinator can refer that individual, the person in the nursing facility, to a behavioral health coordinator. Every CHC managed care organization by contract has to have at least one behavioral health coordinator to assist with coordinating that care and navigating that behavioral health system, which is not always easy to navigate. AmeriHealth and Keystone, we have 4 behavioral health coordinators. They report to me. They are licensed and they are skilled at coordinating those services, helping to gain access to those services where previously they may not have been, there may not have been access. We coordinate with the dual special needs plan and the behavioral health managed care organizations to identify providers who can help meet those behavioral health needs. Many facilities have contracts with a behavioral health provider where they allow, you know, maybe one provider to come in to provide counseling or psychiatry med management for the participant, the individual living in the facility. But for those that don't have that, or for those who are Medicaid, you know, they can contact their service coordinator and we can, you know, we can work to get those services provided to them. The focus of the Office of Long-Term Living and the CHC managed care organizations in 2022 is to actually increase access to behavioral health services. We have upcoming webinars for nursing facilities to educate them about the various services that are available to them through the Medicaid plan. And we're also working with the Office of Aging and with the Ombudsman program for increasing access and also increasing the identification of need, because sometimes people have a need and it's not recognized. So we're trying to work to gain, to enhance the recognition of any kind of unmet behavioral health needs, so that individual in the nursing facility can be in contact with their service coordinator, and we can help them get the kind of assistance that they would need. If you know, if any of your loved ones are interested in, and they're part of the CHC program, if they're interested in transitioning out of the nursing facility, we provide support with that as well. They should contact their service coordinator. If they don't know who their service coordinator is, each of the plans has a customer service number on the website. And I can get the phone numbers to you guys as well, but you should notify your service coordinator or the resident of the facility, the service coordinator associated with that resident, so that we can work to help the individual get the services that they need to be successful for community living. We help with making sure that they're eligible for those home and community-based services and getting those services set up prior to transitioning out of the nursing facility. So if someone is moving into a residence where they already have a living situation, so if someone's moving in with a family member, or if they have their own home that they're moving back into, our service coordinators can work with the individual to make sure that those home and community-based services are set up and that we can maximize their success in the community. If someone does not have a place to stay, does not have a residence, they're still interested in moving out of a nursing facility, then we can help them with that too. We can help them with moving into their own community residence. We have services in place to help them with identifying and locating housing. That would include completing housing applications, accessing subsidized housing opportunities, helping them with getting to lease signings, things like that. We can help them with setting up their home. So we can help them with a security deposit, with the first month's rent. We can help them with what we call essential furnishings, which would, you know, if you could imagine, would be like a bed, a dining table, eating utensils, pots, pans, towels, like things like that. We can help them with moving expenses, you know, from moving the items from where they're staying now in the facility to their home. And if it's a new apartment, we can help them with the one-time fees with setting up utilities, any kind of things like that. AmeriHealth and Keystone has a value-added program where we can help with, like, if someone needs help with getting an ID, you know, you can't sign a lease and things like that. You can't apply for subsidized housing if you don't have an ID. So some individuals may have misplaced their ID, so we can help with paying for getting an ID, getting a birth certificate, help with like the initial setup of groceries. You know, it's when you're moving into an apartment or into a home and you haven't been there and it's, you know, all brand new, like there are things that you don't even think of, like you need salt and pepper and you need, you know, food and you need cleaning supplies and all that kind of stuff. And so we can help with providing those things to them. The other thing we do is we help with coordination. So we work with the social worker to ensure that the durable medical equipment that is needed is ordered and received. And we ensure that someone is at the new residence to receive that durable medical equipment, making sure that those behavioral health services that we talked about are set up in the community. We work with the social worker to ensure that a pharmacy is identified, that a primary care physician is identified, and that an appointment is set up, that someone is, you know, someone has to go to a dialysis center, that a dialysis center is identified and that those initial appointments are set up, any kind of specialist. So we work with the social worker to make sure all of those things are set up if someone is interested in transitioning. So basically, you know, we would like to work with you guys as family members. Please think about it. Let your loved ones know that coordination with behavioral health services is available if someone is in a facility, as well as nursing home transition. And basically, you know, if any of those things are things that would be of interest or of need, you know, you would basically need to contact the service coordinator who would work with the individual in the nursing facility to help with connection to those supports and services. So, and with that, I'm going to just pause and see if there are any questions. No, I just rambled on
in
and
the
on.
chat. Oh, I'm sorry. In the
No,
chat, there's question. Are the slides going to be available after the presentation?
So so this is not really a PowerPoint. It's basically, it's information that was provided from the website for the Department of Human Services and from the Community Health Choices website. So they are free to the public domain. So I'm fine with anybody sharing whatever they want. So yeah.
Okay. And there's a question if Caritas and Keystone are under one plan.
Yeah, we are. It's really kind of weird. I always say that we're kind of like, I don't know. It's like two sides of one coin. I don't know. We're the same coin, but on one side we're AmeriHealth, and that's in, if you remember the map, that's in the Northwest, the Southwest, the Lehigh Cap in the Northeast. It's just in the South. Yep, right there. So it's just that gold, like the dark gold down in the Southeast. That's where we're known as Keystone First. And all the other four is where we're known as AmeriHealth Caritas. It's just kind of weird. I don't fully understand it. I just know that's what it is. So.
I know this is sort of putting you on the spot, but do you have an idea now how much Community Health Choices pays per day to the nursing homes? Is it still based on the case mix index, or did they change that when they redid how things are done?
Right, so that would be out of my scope because that's like contracts are negotiated with our provider network team, and so I would not have any idea.
All right, that's okay. And there is, let's see, we've got, the question is, what does behavioral health deal with? What types of issues?
Right, so if someone needs med management, if they need, so med management, like if you imagine that someone has depression or something like that and they're not being treated or they're not receiving enough services, it could include counseling services, it could include case management services, it could include, are you talking, so let me finish my thought here. I do this all the time. It could include case management, it could include peer support services. Those are things that are available to individuals that are in a nursing facility. As far as behavioral health in the community, it could be all of those things. There are some additional supports that are also available. Telehealth services are available for individuals who are in the nursing facility as well. So if, you know, we're not able to get a provider in there because, you know, depending on what the nursing facility's requirements are and things like that, we can negotiate and get telehealth services involved as well. There are some more intensive services that are available for individuals who have some, you know, significant and persistent long-term mental illness, things like that.
Okay. We have another question. Has the Community Health Choices seen difficulties with transitions out of long-term care facilities due to staffing with home care services?
Right. So there has been some of that depending on the region, especially in the more rural areas. But I know that we are working on that. I know that the Office of Long-Term Living has been providing funds from the ARPA funding from the federal government to home and community-based service providers to see if they can, you know, encourage more individuals to do that kind of work. There's been shortages all over the place, though.
Right. Another question, someone is wondering if we're going to get the graphics sent out tomorrow. Or I believe it says we will get the graphics sent out, so yeah. I think those are all the things in the chat. I'm not sure if anybody has their hand up. I'm looking, I don't see anybody with their hand up, but maybe.
So I'd really like to encourage people that if you do have a resident that's in a nursing facility and they are not getting the behavioral health services that you feel that they need, to please reach out if they are, you know, part of the CHC plan, regardless of which CHC plan it is. It doesn't have to be AmeriHealth or Keystone, but please reach out to the service coordinator. We really want to see the individuals in nursing facilities receive behavioral health treatment to help them. You know, it's sometimes it doesn't happen, and so we'd really like to see that happen. And then also, like I said, you know, if any of your loved ones or if you know of anyone who would be a good candidate for transition, you know, a number of years ago, my mom was in a nursing facility. And truth be told, if I knew that nursing home transition services were available, she would have moved home with me. I didn't know that in-home supports were available. I didn't know that, you know, we call them personal assistance services. I didn't even know that those things were available. And if we would have had those, if I would have known that, she would have been in my home, but I just didn't know that that was available. So, I mean, even things like a stair glide, like we pay for those things. You know, so, so please keep that in mind. This is something that's really near and dear to my heart because I wish my mom hadn't been in a facility, so.
We do have a hand up.
Hi, I just want to say my husband's been a resident of a nursing home for 6 years. Before he did go to the nursing home, he did go to a counselor once a week. And of course, when he went into a nursing home, they had to stop doing all that. And that was a hard thing to do. And I'm very interested in this. He's there in Venango County, and I'm very interested to see if I could get him more help like that. He's 60. He has Huntington's.
Okay.
So,
Do you know if he is part of a Community Health Choices plan? And I don't need to know which plan or anything like that, but.
yes, he is. And I did not understand anything that it involved whatsoever before today. I did not know anything what that was. Nothing. So thank you.
I'm glad that this is helpful, and there are supports that are available. So whichever community health choices plan he's with, reach out to the service coordinator. Let them know that you're interested in behavioral health services for him. This is something that we really want to make sure is available to people.
Thank you.
Mhm.
And we did have a comment related to that from Melody, who said behavioral health, excellent. Too many times this is unrecognized.
Yeah, and it's one of the things that my team is really working on in 2022. And I told you that the Office of Long-Term Living is also, they are setting up webinars for the nursing facilities to educate them on the availability of that coordination and how to access those services, through the service coordinator. But I know with my team as well, we're really focused on that. And I have the benefit of managing both the behavioral health and the nursing home transition team. So I know with us, we're changing our process so that we to try and focus on recognizing those unmet behavioral health needs in individuals in a facility, and especially those who are transitioning, because what we were finding is that someone is on medication for antidepressants in a nursing facility, they're transitioning out, and then 2 weeks before they transition, people are like, oh no, who's going to manage his antidepressants? And let's get him into a psychiatrist. Well, it takes 3 months to see a psychiatrist, so, we're really focusing on planning for those things ahead of time so that there's a seamless transition and the person has the optimum opportunity for success upon transition.
We had another comment in the chat from Patsy. She says she works in a state-run SNF, and she believes that their residents or skilled nursing facilities, she believes that the residents are not part of any community health choice program. They are straight MA, the old access. Do they have a service coordinator?
So yeah, actually, when we moved statewide, right, when we moved into that third zone or third section, the green, the yellow, and the blue in January of 2020, anyone who is Medicaid in a nursing facility has a service coordinator, okay? So all of those residents who are funded by Medicaid actually have a service coordinator. And each of the CHC plans have a service coordinator that's assigned to a facility. So it's not like, one facility would have 50 different service coordinators, right? They may have one from Pennsylvania Health and Wellness, they may have one from AmeriHealth or Keystone, and they may have one from UPMC. They might have more depending on the volume of individuals. For instance, if you have a very large nursing facility and there are 300 Keystone First or 300 AmeriHealth residents there, then we have more than one more than one service coordinator for that nursing facility. But if we only have 50 people there, it would just be that one.
And now we have a question in the chat. How would a family member find out who their coordinator is? Would they talk to the facility social worker, or how would they find that out?
Right. So first of all, if they know which plan they're with, right, they could talk to the welfare office. The welfare office would be able to tell them which plan they have, and they would be able to contact the member services number for each of the plans. And like I said, if you want, I can shoot out tomorrow. I can shoot out to Jamie what those phone numbers are for each of the 3 plans.
I think that would be great, because then she could disseminate it to everybody.
Yep, I'd be
Thank
happy
you.
to do that.
Absolutely. We'll definitely get that out to everyone. Any more questions?
So Patsy, I see you say your residents don't have CHC. Sorry, I'm just like poking my nose in the chat there, but
Yeah, I
Are they
already
fun-
read, yeah, go ahead, go
oh,
ahead.
that's, if they're funded by Medicaid, they do. They do have community health choices.
All right, I'm
Any
not
other
seeing
questions?
any hands up right now.
Okay.
Well, thank you so much. We got a lot of good questions there and a lot of good information.
And so, Jamie, you have the graphics that you'll share tomorrow, and then I will send out, maybe before you send them out, I can go ahead and gather those phone numbers for you, and maybe even the websites, you know, so that people can go to the websites for all three plans and
Absolutely.
take a look at what might be available for their loved ones. And then that way you can disseminate that along with the graphics that were shared today.
Very good. Thank you.
Sure.
I
Right.
think I learned a
Anything
lot.
else?
I don't see anything else in the chat, but I think the group is very appreciative of you explaining this.
Okay. It's my deep pleasure, and I'm looking forward to working closely with the Ombudsman program going forward as well.
Oh, we got excellent presentation. Everybody's enjoying it.
Okay.
Thanks again.
All right. If there's nothing else, should I know you have other things to discuss. Should I just drop off, or I don't know?
Sure, if you'd like to. We're just gonna review our upcoming meeting topics and then probably close it up. So thanks
All right.
again.
Thank you. Appreciate your time. If you have any questions, feel free to shoot them to Jamie. Jamie, I'm volunteering you here, but feel free to
No
shoot
problem.
them to Jamie, and then I'd be glad to answer whatever I'm able to. Thank you,
so
everyone.
much. Have a great night.
Bye.
All right. So our upcoming meeting topics. So on February 22nd, it's a lot of twos in that one. We're going to hear from Ann Weisbrod. She's going to talk about sexual expression and intimacy in long-term care. And then on March 8th, we're going to have a call to action. We're going to have a presentation from Carolyn Green discussing some of the changes to the Older Adult Protective Services Act that involves background checks for long-term care providers. We might have another speaker there because we had a few things come across with the governor this afternoon or this morning. So we might be adding a little bit to that, but it'll definitely be a call to action for everyone. So we really look forward to everyone attending these next two meetings. We have a pretty good lineup here. And if anybody has any specific questions, if there's any topic that you would like us to cover, you can send us an email or give us a call at the State Ombudsman Office, 717-783-8975 or LTC-ombudsman@pa.gov. Thank you everyone for joining us this evening. Stay warm and we'll see you in 2 weeks.